my name is Dr. Shoma Datta-Thomas of Maiden Lane Medical. I'm a board-certified gynecologist and fellowship trained with a specialization in minimally invasive surgery, and this refers to major surgery performed through small incisions and small cameras. And this is referred to as laparoscopy or robotics. I'm thrilled today to have the opportunity to speak with you about uterine fibroids. It is a non-cancerous, benign tumor made up of the muscular tissue of the uterus. And they range in size from anywhere smaller than a pea to a grapefruit, and even on occasion, much larger. And the size and the location of the fibroid, meaning either in the inner cavity of the uterus, which is where a pregnancy would grow, within the muscular wall, or on the surface of the uterus. The size and the location really are what dictate your symptoms and our treatment. Fibroids are present in up to 80% of women. This doesn't mean all women are symptomatic or troubled by the fibroids, but it is something that can generally be found in a large part of the general population of women. Now, when we see patients present to the office for a problem related to a fibroid, they most commonly are having issues with bleeding. Very heavy periods, bleeding outside the time of the periods, and often it can be crampy and associated with other symptoms such as an enlargement of the abdomen, abdominal pressure, pelvic pressure, bladder pressure leading to frequent urination or difficulty urinating, and even rectal pressure or pressure during intimacy. And so when we see these symptoms, we do tend to make sure we rule out fibroids. And we begin the workup with a basic physical exam. So this is just a regular bimanual exam. We call it a pelvic exam, where we feel the size, shape of the uterus. We look for any enlargement, any irregularities, and that in combination with our imaging will confirm fibroids. We use a sonogram or an ultrasound, or in combination perhaps with an MRI, to really try and nail down and clarify the size and location of the fibroids. This can be starting with medical treatment, which can even be just targeted at the bleeding. So we can use a variety of different types of contraception or birth control. And this does have the possibility of slowing down bleeding, stopping bleeding in between, and putting you back in a regular cycle. When we think about if we have to intervene with anything more than just regular medication to regulate your bleeding, we have to think about your age, your reproductive stage, meaning have you been pregnant already? Are you planning pregnancy in the near future? Or are you done childbearing? And this will really dictate where we go with the treatment and how far we go and what our goals are. If we're not just aiming at a medication to control the bleeding, we can do another medical treatment, but it's usually something temporary, and that's called a GnRH agonist, which essentially temporarily suppresses the hormones so that we get some effect of fibroid decrease in size and stopping the bleeding temporarily. The first would be something called an endometrial ablation. And again, this is really just targeted at controlling bleeding. And this is usually once you're done with pregnancy and done with childbearing. So it's a small procedure. It's a same-day procedure where you can go home after it's performed, but we essentially treat the uterine lining, and we use a device that basically does a thermal treatment to kind of singe that inner uterine lining, or a burn for lack of better words, but it prevents that lining from building up and shedding heavily as a heavy period or irregular bleeding. Now, what we go on to next can be something that is non-invasive, and it's something that we would refer you to a radiologist, and this procedure is called a uterine fibroid embolization. And what the radiologist does is they basically map out your blood vessels, and they do through catheterization a very strategic targeted blockage of the blood vessels that feed the fibroids, and that does give size decrease and improvement in bulk symptoms and bleeding. There are also a category of women who choose hysterectomy for the treatment of fibroids. And this is for definitive treatment, meaning there's no way the fibroids can come back. And this is by removing the entire uterus, obviously with the fibroids contained within the uterus. And in this case, we usually do aim to leave the ovaries behind. So this will not cause you menopause. And this again is done through the open incision, depending on the size of the uterus and overall general patient factors. And also there are often minimally invasive options for the hysterectomy. So again, done laparoscopically or with hysterectomy, and again, that minimal recovery, improved issues of pain, and in fact also minimally invasive options for myomectomy and hysterectomy do give, in addition to decreased time recovering and decreased pain, they decrease overall infection, blood loss, and a number of other improved factors. Once we have to get to address larger fibroids or fibroids that are outside of just the inner cavity, then we have to think of what we generally term as an abdominal approach. It means some kind of incision through the abdomen to use instruments to remove just the fibroid. And this can either be done through what's called an open incision. So it can be across the lower abdomen, such as like a C-section incision, or based on, for extremely large fibroids, we may even have to make a vertical incision, which is an up and down, to accommodate the size of the fibroids. What we specialize in with minimally invasive surgery, especially at Maiden Lane, we really try to use a laparoscopy or a robotic procedure to try and minimize these large incisions, to safely remove the fibroids, but use small incisions which make your pain minimized compared to a large major surgery. So minimizing pain and making the recovery overall much quicker. So typically you are home the same day with certain instructions and follow-up, and then we see you in the office in about 2 weeks and 6 weeks, and you are usually able to kind of go back to somewhat of your normal routine, maybe working from home after a week or two, and then fully back in your routine in terms of exercise and normal physical function after about 6 weeks. But again, after a couple weeks, you're able to kind of get back into your daily routine, maybe work or whatever your normal routine is. So that's really our overview of how to treat fibroids and what exactly fibroids are. We really are fortunate to have a lot of experience with this at our practice, and it is something that can very seriously affect the quality of life of women. And so we do take it seriously and aim to really work with every patient on individualizing care. And that's always a priority for us.